Today we're going to talk about our digestive tract. You know, there is probably no part of the body that is as affected by foods as our digestive tract because it's really the beachhead. It's where foods occur first. So let's take a look from the top all the way down to the bottom of how foods can affect us. First thing, gastroesophageal reflux, GERD, heartburn. That's when the stomach, which has acid in it, is allowing that acid to go up back into the esophagus, so you feel this burning sensation back behind your chest. Well, what causes it? We don't really know what causes it for everybody, but here are the most common suspects. Having extra weight, meaty diets, and other fatty foods. For some folks, it might be caffeine or alcohol. Peppermint is an interesting one. It actually loosens up that muscle at the top of the stomach, allowing the acid to come through. For some folks, it might be chocolate. But what we see a lot of the time is when people lose weight and when they go on low-fat vegan diets, for whatever reason, their GERD often cleans up. Irritable bowel. Irritable bowel syndrome is where your digestive tract really isn't your friend anymore. One day it's constipation, the next day it might be diarrhea. It really can't make its mind up. And you have pain with it and you have bloating with it. Well, one of the most common contributors to this can be milk products. Milk contains a sugar called lactose. And have you heard of lactose intolerance? It's a totally normal condition. All it means is that you're not a baby anymore, so you don't have the enzymes anymore for digesting milk. And this is actually the biological norm. What I mean by that is if you were to test adults all around the world, most of them have lactose intolerance. They no longer have the enzymes for digesting milk. So the lactase enzyme breaks the lactose into two smaller sugars, glucose and galactose, and once that enzyme is gone, you're stuck with this big load of lactose going down into your intestinal tract. Bacteria ferment it, they make gas, and that's a big cause of irritable bowel. Solution, leave the milk and dairy products off your plate. Very easy. Now there are some other contributors too, not just dairy products. For some people, artificial sweeteners, if they're using a lot of them, can irritate their digestive tract. Fatty foods can as well. When fat touches the intestinal wall, it causes the muscles to contract a little bit, and sometimes it's a little bit like squeezing a tube of toothpaste on both ends at the same time. Ouch. Some people might have a problem with wheat, some with eggs. Peppermint oil might actually help because in this case, it relaxes the muscles of the digestive tract. Now, even more serious, Crohn's disease and ulcerative colitis. These are inflammatory conditions. If you could look at the intestinal tract, it looks angry. It's red and it's inflamed, and sometimes it earns you a trip to the operating room. Well, see your doctor if you have these conditions by all means, but be conservative. If you don't have to have surgery, by all means put it off. And doctors are now looking at diet changes that might help. We're seeing this especially with Crohn's disease. For some reason, many people do very well when they get away from dairy products. High fiber foods used to be forbidden for people. Now we know that they're the best thing for you. So that means well-cooked beans and vegetables and fruits, whole grains. You might want to go easy on the raw vegetables and fruits if you're having trouble with them. Let's talk about gallstones. Gallstones can be really painful, but there's a lot we can do with our diet to improve things. The liver makes something called bile. It's a digestive juice. It helps us to break apart the foods that we're eating. The liver takes this bile, it sends it into the gallbladder where it's stored, and then after you eat a meal, it goes down the common bile duct and it goes into the intestinal tract to help us digest food. But sometimes this bile starts to crystallize. It's like it's forming little nuggets right in the gallbladder or elsewhere in that biliary tree. This is the pancreas, and you can see right there on the left-hand side there is a spot where a gallstone perhaps could form. Ouch, you don't want that. Well, if you could look at them under a microscope, what you discover is they are mostly made of cholesterol. So the solution to gallstones, surprisingly enough, is very much like the solution for heart problems. We want to lower our cholesterol. That means reducing the fat in our diet, especially the animal fat. Get that out of the diet. Increasing high fiber foods. That's whole grains and beans and vegetables and fruits. And losing weight in a healthful way is really important too. Now, sometimes when people lose weight really too fast, by starving themselves, sometimes gallstones can actually form. So what you want to do is to follow a low-fat, plant-based diet, and the weight loss is healthy and gradual. Let's talk about colon cancer. It's a serious condition, and it's particularly common in westernized countries. Why would that be? Well, it turns out that it's strongly linked to a meat-based diet. If you compare people who rarely have meat to men or women who have meat more or less every day, those who have it about every day have roughly 3 times the risk of developing colon cancer compared to people who don't eat meat or eat it only very rarely. Well, why would that be? Why would meat lead to colon cancer? Well, first of all, fatty foods actually change your intestinal bacteria. Did you know that you have bacteria in your intestine? That's perfectly normal. But if you feed them a fatty diet, it's a funny way to think about it, but that's what we're doing, those bacteria actually change. They become the kind of bacteria that can produce carcinogens from your own digestive juices. So you don't want to be feeding a lot of fatty foods to them. That means getting away from the meat. Secondly, you need fiber in your diet, but meat doesn't have any fiber. It's not from a plant, so it doesn't have plant roughage. And if you don't have fiber in your diet, what happens to your digestion? It slows down. And if it slows down, then anything that's there, any carcinogen, cancer-causing chemical, that might be working its way down your digestive tract, it stays there that much longer. And that's not good. So we want fiber in our diet. And third, cooking can produce some cancer-causing chemicals, and I'm going to come back to that in a minute. But you really want to bring back the fiber, and let me remind you of these numbers. We've talked about this before, but a typical serving of beans, about 7 grams of fiber, vegetables about 4, a typical fruit like an apple or an orange, maybe about 3 grams, bread, a little bit lower, a little bit higher depending on the type, cold cereals, roughly 3 grams per serving, oatmeal, about 4. Earlier I said that cooking can be a problem. A lot of people are getting away from fried chicken. That's a good choice. You'll skip a lot of fat. But some of them are switching to grilled chicken. And killjoy that I am, I have to say, I went and tested what's in grilled chicken. You know those black grill lines that you see? Well, it turns out when you send a little bit of that material to a lab and ask what's in it, they come back with something called FIP. Here it is. This will not be on the test, but this is the chemical structure of FIP. It's a carcinogen. That is, it's a cancer-causing chemical. How is it produced? When you grill skeletal muscle, I'm talking about the muscle of an animal. It could be a fish, it could be a chicken, or it could be beef. When it's cooked at that high grilling temperature, these carcinogens form. My team went to McDonald's. We went to Applebee's and Burger King and Chick-fil-A, Chili's, Outback, and TGI Fridays, and we took their grilled chicken sandwiches and grilled chicken salads. We sent them to a laboratory, and you know what? We found this FIP carcinogen in every single sample at every single one of these restaurants. So it's a reliable thing. If you want to avoid these carcinogens, the answer is pick something other than that grilled chicken. By the way, if you grilled vegetables, these cancer-causing chemicals don't form. It's formed when you heat up muscle tissue, that's meat, at a very high temperature. We've got more good news when it comes to colon cancer. Not only can we make diet changes to help prevent it, it turns out that a person who has been already diagnosed with colon cancer, if they make diet changes, they go to a plant-based diet, a high-fiber diet, it improves the odds of survival. And let me get even a little bit more personal, if I may. Let's talk about hemorrhoids. Years ago, a wonderful researcher named Dr. Dennis Burkitt started looking at why certain conditions are really common in Europe and America, but rare in Africa and other countries. And what he found is that if you're not eating fiber, well, what happens? You get constipated, but people spend a lot of time in the bathroom because they're constipated. And if that happens, then they start pushing extra hard. Are you with me? Well, if you're pushing hard because a person's trying to go to the bathroom, what happens is the blood vessels of the lower part of the abdomen start engorging with blood, and that's the cause of hemorrhoids. And you know what? The most grateful letters that I get from people are not from people where their diabetes went away or we've cured their cholesterol problem, but when their hemorrhoids went away, I got to tell you, that's one grateful person. Similarly, at the top part of the abdomen, your stomach is up there, and when a person is pushing really hard in the bathroom, their stomach can actually lift up through the diaphragm. That causes what we call a hiatal hernia, and that's caused a heartburn. So very simple. Bring the fiber back in the diet. There's no more constipation. Going to the bathroom is an easy thing, and it's not a big issue anymore, okay? So we've talked about problems from the top to the bottom, and it's easy. A low-fat vegan diet, keeping the oils out of the diet, bringing the high-fiber foods in, that's going to really help your digestive tract and make you feel better too. Thanks a lot.